Listen. Can you hear that? It's the sound of a clock ticking away the seconds. 1, 2, 3. In the time it takes for you to simply register that sound, a master surgeon of the 1840s could have you strapped to a table, a crowd of spectators staring down at you, and his saw already halfway through your leg bone. Another 10 seconds and the severed limb would be tossed into a bucket of sawdust. A few more and a red-hot iron would be pressed against your stump to stop the bleeding. The entire ordeal from the first cut to the final searing agony might last less than 3 minutes, and for every single one of those seconds, you would be awake, you would be aware, and you would be screaming. This was not a torture chamber. This was an operating theater. This was the pinnacle of medical science. Speed was the only virtue, the only mercy a surgeon could offer his patient, because in the world before anesthesia, surgery was not a cure. It was a terrifying spectacle of agony, a desperate, brutal race against death itself. To understand the world that existed before our modern age of quiet, sterile, and painless surgery, we must first step into the environment where this horror unfolded, the 19th century operating theater. Forget everything you know about surgery today. This was not a private, gleaming white room. It was a public arena, an amphitheater built with steep tiers of wooden benches packed with onlookers. Medical students, paying spectators, and morbidly curious members of the public would crowd in to watch the performance, jostling for the best view of the carnage below. The air itself was thick and heavy. It was a foul mixture of sweat, unwashed bodies, stale blood, and the metallic tang of fear. The floor was often bare wood, covered in a layer of sawdust to soak up the inevitable torrents of blood, which would be shoveled out after the day's operations were complete. In the center of this theater stood the operating table, a sturdy wooden contraption, often with leather straps to restrain the patient. It was less a piece of medical equipment and more an altar for a terrifying ritual. And at the center of this ritual was the surgeon himself. He was not the meticulous, clean-shaven scientist we picture today. The surgeon of this era was a showman, a performer, and often a brute. He was judged not by his precision, but by his speed and his strength. He needed the physical power to hold a struggling patient while sawing through their bone, and the psychological fortitude, or perhaps callousness, to ignore their blood-curdling screams. His uniform was not sterile scrubs, but his everyday street clothes over which he wore an apron. This apron was his badge of honor. It was often made of stiff leather or canvas and was rarely, if ever, washed. It would be caked and stiffened with the dried blood, pus, and gore of countless previous operations. A surgeon took pride in this filth. It was a testament to his experience, a walking resume of his bloody work. He would walk from one patient to the next, carrying the germs of the last operation on his hands and on his unsterilized instruments. These instruments, the gleaming knives, the heavy bone saws, the cruel-looking hooks and forceps, were often wiped clean on a rag or even the surgeon's apron before being used on the next victim. The concept of microbial infection was a mystery. The real killer, they believed, was the shock and trauma of the procedure itself. The only way to minimize that trauma was to make it brutally, inhumanly fast. In this age of agonizing speed, one man was king. His name was Robert Liston, a towering Scotsman standing at 6'2", with a powerful physique and a notoriously fearsome temper. Liston was the undisputed superstar of the London surgical scene. His nickname was the fastest knife in the West End, and his operations were legendary, drawing huge crowds of spectators eager to witness his prowess. Liston was a force of nature. He could move with a speed that defied belief. It was said he could complete a leg amputation in 2.5 minutes, from the first cut of the knife to the final stitch. In one famous instance, he amputated a man's leg in under 30 seconds. The patient, when later asked about the experience, claimed he wasn't even sure the operation had started until he saw his leg flying across the room. Liston was so fast, he once removed a 45-pound scrotal tumor, which the patient had to carry around in a wheelbarrow, in just 4 minutes. He was a showman through and through. Before an amputation, he would stride into the operating theater, glance at the packed stands and declare, "Time me, gentlemen, time me." He would take the large amputation knife, called a bisturi, and hold it between his teeth to free his hands as he strapped down the patient. Then, with a blur of motion, the work would begin. His speed was his compassion. The less time the patient spent under the knife, the greater their chance of surviving the shock. And yet, this very speed could lead to a particular kind of recklessness, culminating in what is likely the most infamous surgical case in history. It is the only operation on record with a 300% mortality rate. The patient was on the table for a routine leg amputation. Liston, with his usual theatrical flair, called out to the gallery to time him. He went to work with his typical ferocious speed. In the blur of his movements, as he sawed through the bone of the patient's leg, his flashing knife accidentally sliced off several fingers from the hand of his young assistant, who was helping to hold the patient still. As he swung his bloody knife back, he also slashed through the coattails of a distinguished spectator who was watching a little too closely. The results were catastrophic. The patient, as was common, later died of post-operative gangrene from an infected wound. The young assistant, his fingers mangled, also contracted gangrene and died a few days later. The spectator, upon realizing he had been cut by the gore-soaked blade, was so overcome with terror at the thought of contracting a fatal infection that he dropped dead from shock on the spot. One procedure, 3 deaths, a 300% mortality rate. It was a grim, almost comical testament to the chaos and brutality of the age. To truly understand the visceral horror of this era, we must move beyond the perspective of the surgeon and the spectators and try to experience it through the eyes of the patient. There is no better or more harrowing account of this than the one left by the celebrated English novelist, Fanny Burney. In 1811, she was diagnosed with breast cancer and had to undergo a mastectomy without any form of anesthetic. Her detailed, first-person account is a literary masterpiece of medical horror. She described being led into a room draped in old sheets, where she saw the 7 male doctors who would perform and witness her ordeal. They laid her on a bed, and she was covered with a thin cambric handkerchief. She wrote of the moment she saw the horrifying glint of the polished steel instruments laid out on a table. She described the chief surgeon telling her to prepare herself, and her own terror as she realized they were about to begin. In her own words, she wrote, "I started up, threw off my veil, and cried out, 'No, I will not be blinded.'" She chose to watch. She narrated the moment the steel was plunged into her breast, cutting through the veins, arteries, flesh, and nerves. She described a horror that was beyond words, a pain so excruciating she felt it in every atom of her body. She wrote of the knife scraping against her ribs, a sound she said she would hear for the rest of her life. The operation lasted for what felt like an eternity, as the surgeon meticulously dissected the diseased tissue. Her screams, she admitted, were so unending that they terrified everyone in the house. Miraculously, Fanny Burney survived the procedure and the almost inevitable infection that followed, living for another 29 years. But her account is a priceless, terrifying window into the soul-shattering agony that was once a routine part of the healing arts. Other common procedures were just as barbaric. One of the most feared was the lithotomy, the removal of bladder stones. The patient would be held down, their legs forced up and apart. The surgeon would insert a tool up through the urethra to stabilize the stone, and then make a deep incision in the perineum, the sensitive tissue between the scrotum and the anus, to access the bladder. He would then insert forceps to grasp the stone and forcibly pull it out. It was blindingly painful, prone to catastrophic infection, and often resulted in permanent incontinence or impotence. Again, the only measure of success was speed. A good surgeon could be in and out in 5 minutes. A bad one could take an hour, by which point the patient would almost certainly die from shock and blood loss. This was the world of surgery, a realm of controlled, time-limited torture, where survival was a matter of chance and the ability to withstand unimaginable pain. But humanity's age of agony was about to end. thanks to two of the most important revolutions in all of medical history. The first revolution was the conquest of pain itself. For centuries, doctors had searched for a way to dull the senses during surgery. They had tried opium, alcohol, and even crude methods like knocking the patient unconscious with a blow to the head. Nothing worked effectively. The dawn of the new age began with dentists experimenting with gases. A dentist named Horace Wells believed nitrous oxide, or laughing gas, was the answer. In 1845, he arranged a public demonstration at Massachusetts General Hospital, where he would extract a tooth from a patient under the influence of the gas. But the patient, not fully sedated, cried out in pain at the crucial moment. The skeptical audience of surgeons hissed and booed Wells off the stage, calling him a humbug. The search seemed to be a failure. But one of Wells's former partners, a dentist named William T.G. Morton, was convinced there was a better way. He began experimenting with a different substance, sulfuric ether. After perfecting his technique, he arranged his own public demonstration at the very same hospital in October of 1846. A patient was brought in who needed a tumor removed from his neck. Morton administered the ether via a glass inhaler. The patient went limp. The surgeon, Dr. John Collins Warren, who had been present at Wells's failed demonstration, skeptically began to cut. The theater was silent. There were no screams, no struggling. The patient lay still and quiet as the tumor was successfully removed. When the patient awoke, he confirmed that he had felt no pain, only a faint scratching sensation. Dr. Warren, stunned, turned to the astonished audience and made one of the most famous proclamations in medical history. "Gentlemen, this is no humbug." The news spread like wildfire. Within months, surgeons around the world were using ether. The Age of Agony was over. The screams from the operating theater finally fell silent. This discovery fundamentally changed the nature of surgery. Speed was no longer the primary virtue. For the first time, surgeons could be slow, careful, and meticulous. They could explore the internal landscape of the body, attempting complex, life-saving procedures that would have been unthinkable just years before. But anesthesia solved only one half of the problem. While patients no longer died from the shock of pain, they continued to die at an appalling rate in the days and weeks following their operations. The wards were filled with the sick-sweet smell of rotting flesh. Postoperative infection, known then as ward fever or hospitalism, was rampant. A patient might survive a painless amputation only to die in agony from sepsis. Surgeons unknowingly carried deadly bacteria from one patient to the next on their unwashed hands and unsterilized instruments. The second revolution, the conquest of the unseen killer, was led by an English surgeon named Joseph Lister. Lister was deeply troubled by the high mortality rates in his surgical ward. He began to study the groundbreaking work of the French chemist Louis Pasteur, who had recently demonstrated that invisible microorganisms, germs, were responsible for fermentation and disease. Lister theorized that these same germs were getting into surgical wounds and causing the fatal infections. He began experimenting with a substance called carbolic acid, which was known for its use in treating sewage. In 1865, he treated a young boy with a compound leg fracture, an injury that was almost always fatal due to infection, by soaking the wound and the dressings in a carbolic acid solution. The boy survived. Lister had performed the first ever antiseptic surgery. He developed a system where he would not only treat the wound, but also spray a fine mist of carbolic acid over the entire operating field, killing the germs in the air on his hands and on his instruments. His mortality rates plummeted, but his ideas were met with fierce resistance. The established surgical community scoffed at his germ theory. They took pride in their blood-stiffened coats and believed that a surgeon's hands should be unhampered by washing. For years, Lister was ridiculed. But his results were undeniable. Slowly, painstakingly, the medical world came to accept the reality of germs. The era of the dirty surgeon was over. The twin revolutions of anesthesia and antisepsis, occurring just decades apart, dragged medicine out of the Dark Ages. They transformed surgery from a brutal, desperate butchery into the refined, life-saving science we know today. The story of what came before is a horrifying, almost unbelievable tale of screams, speed, and sepsis. It is a profound and unsettling reminder that the calm, sterile, and pain-free experience we expect from surgery is an incredibly recent invention, a gift bought with centuries of human agony and built upon the foundations of a truly morbid past.